Hello, and thank you for tuning into the program. I'm your host, Neal Howard, here on Health Professional Radio. Our guest today is Dr. Jason Hafron. He's going to speak with us in our continuing series concerning advanced prostate cancer. He's here today to talk with us as a partner at the Michigan Institute for Urology to discuss prostate cancer and immunotherapy for, as I said, advanced prostate cancer. Welcome to the program, Dr. Hafron.
Thank you very much, Mr. Howard. It's a pleasure to be here.
Now, talk with us a bit about advanced prostate cancer, just after you tell us a bit about your background.
Yeah, thank you. I'm the Director of Research for Michigan Institute of Urology. We're one of the largest urology groups in the country. I subspecialize in urologic oncology, specifically prostate cancer, the treatment, diagnosis, management, and specifically the management of advanced prostate cancer. Advanced prostate cancer is when the cancer has moved outside the prostate and has moved into other organs, the lymph nodes or bones, and also typically at those stages the cancer becomes castrate-resistant. So by that I mean no longer does the Lupron, Eligard, or the androgen deprivation therapy is having significant effects, and the PSA will continue to rise despite castrate-level testosterone.
Would you say that those are the biggest challenges that you face as far as prostate cancer is concerned, advanced prostate cancer, or are there others that are more daunting?
Yeah, well, advanced prostate cancer is a challenge because it is a terminal disease. We unfortunately don't have a cure for it. So, we have a lot of new treatments and great treatments we can offer patients that we didn't have, let's say, 4 or 5 years ago, which is great. But it is challenging because it is a terminal disease. Fortunately, with these new treatments, we can extend life as well as maintain quality of life with these patients. But unfortunately, there's no magic bullet, there's no magic pill or any procedure where we can make advanced prostate cancer go away.
Well, that being said, what are some of the recent advancements that have been made for advanced prostate cancer treatment?
Well, in the last 5 years, there's been an explosion, 5 or 6 new drugs in this space. One of the first drugs to come to market, and one of the first drugs was immunotherapy, specifically Provenge. Provenge was one of the first drugs that showed a significant improvement in overall survival in patients with advanced prostate cancer. And this came out in about 2011 or 10 or so.
Are we talking effectiveness as far as the age of the patient? Does it matter whether it's a young man or a man up in years?
No, age has never been a factor. It's the benefit in overall survival with Provenge is dependent on the stage of the disease. So its sweet spot, or where the patients benefit the most, is the patients with advanced prostate cancer, castrate-resistant prostate cancer that is spread, so metastatic castrate-resistant prostate cancer with very little symptom. So it's best for the patient in the early stage of metastatic castrate-resistant prostate cancer, those with no symptoms or minimal symptoms of their disease. That's the best time to give Provenge, and that's the patients that will benefit most from this treatment.
Now, is that a singular treatment, or is it in conjunction with other drugs based on the stage of the advanced stage cancer?
What we're focusing now with advanced prostate cancer with all these drugs is we layer the therapy. So it's this concept of layering where you just add additional therapies as the patients progress. It's novel therapy because if you think about it, most cancers are treated with multimodal therapy. We will always tend to use combination of chemotherapy, different chemotherapies. We'll use chemo with surgery, chemo with radiation. We'll use a variety of different of these combinations. With advanced prostate cancer, we still have that same thought process where we use multiple different drugs, but we'll just keep stacking them on as the patient progresses. So once the patient becomes castrate-resistant metastatic prostate cancer, we like to give them Provenge. And the nice thing about Provenge is it's really 3 treatments in a 1 month's time. Mm-hmm. And once we get that infused, once we get that in the patient, that will continue to work for long term while we add additional therapies.
Now, this is an ongoing treatment. What about some of the side effects? Is the severity lessened with this Provenge as opposed to some?
Well, it's really, I think of it, Neal, like as a one-time treatment over 1 month, because you really prime the immune system to start killing the cancer, and those effects will be maintained for the rest of the patient's life. Okay, so once you get that on board, the man's immune system will continue to attack this cancer throughout the rest of his life. So even though it's the total treatment's completed in 1 month. As far as the side effect profile of this, one of the great things about this drug is the side effect profile is very minimal. If you look at some of the initial studies done on this drug, only 1.5% of the patients discontinued therapy. So 98.5% of the patients continued on therapy. And most reactions or problems we see at Michigan Institute of Urology are related to the infusion. So when we deliver therapy, we may get patients with some fevers, chills, some rigors, but overall it's very well tolerated and a very safe drug. We've seen no long-term complications associated with Provenge. We've seen, again, most of the problems are related to the infusion itself, which are constitutional fevers, chills, and can be easily treated with Tylenol, Benadryl, and things like that.
What do you see for the future of Provenge? I mean, obviously FDA approved, but as research becomes more advanced, what do you see for the future of Provenge?
Because, I think the future is very bright for Provenge. Immunotherapy is one of the biggest concepts in all of cancer today, and there's a lot of great research, a lot of great things being developed that are impacting patients immediately. So the future for Provenge is great. I think personally, I would like to see Provenge used earlier in the stage of disease. I would like to see Provenge used for patients with localized prostate cancer. I'd like to see it used in patients with unactive surveillance. Can we use this drug, which essentially retools the immune system to attack the cancer with very little side effects? Can we use it in very healthy patients? And what effect will that have on their cancer for the rest of their lives? So I think the key is that I want to use it in earlier stage or test it in earlier stage of disease. Obviously, we wouldn't use these drugs until we've shown that there's clear benefit in good randomized controlled studies.
Now, if we'd like to learn more about the Michigan Institute of Urology and Provenge and advanced stage prostate cancer as well, where can we go online to get some more information, Dr. Hafron?
Recommend you come to our website. We're at Michigan Institute of Urology. Our website is www.michiganurology.com, and that's probably the best way to locate us or go from there.
Well, it's been a pleasure. Dr. Jason Hafron, a partner at the Michigan Institute for Urology. We've been talking about prostate cancer and immunotherapy for advanced prostate cancer. I'm hoping that you'll come back and talk with us in some future segments, Doctor.
Oh, definitely. My pleasure.
Thank you. You've been listening to Health Professional Radio. I'm your host, Neal Howard. Transcripts and audio of the program are available at healthprofessionalradio.com.au and also at hpr.fm. Subscribe to this podcast on iTunes, listen in, and download at SoundCloud. And be sure and visit our affiliates page when you visit us at healthprofessionalradio.com.au and also at hpr.fm.